This segment of DelmarvaLife is brought to you by Mast Audiology.
Hearing loss can affect everyone from newborns to people in their 60s and 70s. It can also be caused by several factors: genetics, age, and exposure to loud noises are some of the more commonly known causes.
Now here's one you might not think about. Diabetes. According to the CDC, hearing loss is 2 times as common among people who have diabetes as it is with those who do not. And as you can imagine, yes, we have a lot to unpack with this subject. So, introducing you to Dr. Shekinah Mast of Mast Audiology in Seaford. Thank you so much.
Thank you.
So with the customers that with the people that you see, do these statistics surprise you, or is it pretty much?
No, that's about
right.
what we see.
Is that right?
That's what I would have thought the statistics were even before I knew them.
Does it surprise people that?
Yes, it always surprises people. They want to know, like, why is that even on the case history as one of the questions I'm asking? It's like, well, there's a reason. All of the things on the case history matter because they build a picture of you and your risk factors. And so,
Okay. So let's talk about that connection. What is the connection between diabetes and hearing loss?
So the same things with the rest of the body. So diabetes is notoriously affecting your nerves, right? So you don't have as good feeling in your feet and hands, the retinopathy that's happening in your eyes, all of those type of things. But also it's affecting blood flow. So the inner ear is obviously a nerve. The auditory nerve is part of a big chunk of how you hear, but also the blood flow in the cochlea is extremely important. So as the glucose kind of builds up in the capillaries, it causes a thickening, the oxygen doesn't get through as well, and those cells literally start dying off.
Okay, so what about the medication for the diabetes? Is that?
They also can cause hearing
Really?
loss. Mm-hmm. So many of the medications for diabetes, while it is controlling some of the effects that the diabetes is having uncontrolled on your hearing and balance, it is often causing some of their own effects because every medication has its downside, obviously. So some of them cause tinnitus, some of them cause balance issues, and some of them cause hearing loss, actually, just in themselves.
How about that?
Oh,
Yeah.
wow.
It's hitting you kind of from both sides.
Yeah. Do you think that older patients might just kind of write off the hearing loss as, well, I'm just aging?
Oh, absolutely, all the time. So it's well, I hear good for being 65, or I hear good for being 70. It's like, yeah, but that's not good. So you're still missing things. You're still not able to communicate effectively the way you should be. Your quality of life is still being affected.
Yeah.
So when it comes to what you do, is the treatment for diabetes-related hearing loss the same, or do you have to adjust what you do?
It's pretty much the same. Education is a big part of it. So
Okay.
just kind of pointing out that obviously these things are also causing problems or could be causing problems, could be making things worse. But really the answer is always, if you have hearing loss, you need to treat it. Untreated hearing loss has a whole slew of effects over time that we know about. Your cognitive issues, your balance issues, tinnitus, depression and anxiety, all of those things kind of are snowballing when you have untreated hearing loss. And the longer you have it, the worse that gets.
So if you're giving someone a hearing exam, are you able to determine whether their hearing loss is caused by diabetes or not?
Yeah, just like really most of the time what we can tell is the type of hearing loss, and we build, again, a picture of you based on your case history and can say it is most likely caused by, but there's no test that says it's definitely caused by that. It's honestly why veterans have a hard time sometimes proving that it was the noise exposure or whatever, because there's not actual proof of that. It's just most likely.
Yeah.
Essentially, when they're looking at those things.
Right. Dr. Shekinah Mast of Mast Audiology, thank you so much.
Absolutely.
I'm always fascinated when you come in and talk to us about hearing.
Yeah.
Thank you.
Yes, thank you for having me.
Did you notice that I fell into my Wilford Brimley stage and started calling it Beatus?
I did, actually.